And I think this slide is, it's a little bit busy, but it shows the 4 different diseases. And I'll just sort of outline why I think those are important, particularly important from the surgeon's point of view. These letters along the side are how UNOS in the United States categorizes the different diseases, and they each have a different trajectory, and so they are allocated at different urgency points when patients are listed. But the first condition is obstructive lung disease. You maybe have heard of this as COPD or emphysema, and it's represented by the first X-ray. And what you should see from the X-ray is the lungs are very big. So this is a condition where the lungs become less elastic and they fill up with air. It becomes difficult for patients to expire, and they end up with very big chest cavities and big lungs. The second condition is pulmonary hypertension, and this is where the blood vessels in the lung start to get a high resistance, and so the pressure in the lungs goes up a lot. And actually the main problem is that it puts a big load on the right side of the heart. And you see in this X-ray that there's a great big heart shadow occupying a lot of the chest X-ray. The third condition here in the bottom right is cystic fibrosis. So cystic fibrosis is the most common genetic disorder, and it causes a condition called bronchiectasis, which is repeated infections of the lungs, which lead to cysts and scarring of the lung with big bronchi. And you can see that the lung spaces are maintained. They're the sort of normal size of lung spaces, but you see all this scarring, and you can see tenting on the diaphragm from the repeated infections that have caused scarring within the lung space. And then I know that most people in the audience suffer from this, the final condition, idiopathic pulmonary fibrosis, which is a form of restrictive lung disease. And this is where the lung scars up, and many times we don't know what causes the scarring. And so the lung spaces get progressively smaller, and this you can see in the X-rays as a reduction in the amount of lung space. So patients with pulmonary fibrosis get small lung cavities with small restricted lungs. And so all of these conditions have different criteria to be referred for lung transplant evaluation, and they also imply different problems for the surgeon trying to remove and replace lungs from these particular patients. And with any patient who's coming for any surgery, really, we're trying to assess what the risks are without doing the intervention and balance them against the benefits achieved by the intervention. And some other factors come in, and I think for pulmonary fibrosis, a question of whether to do a single or double lung transplant is important, and it does affect this risk benefit analysis. And then the final question in this risk benefit analysis is, well, does the type of incision change this, particularly, I think, the operative risk and the rehab risk? And I'll get onto that more later in the talk. And I know that's the main reason why you've tuned in today.